JDCA is the voice of the Jewish Democrats and the only national organization combining Jewish values, advocacy, and democratic political agenda. My name is Susie Stern, and I'm a board member, one of the founding members of JDCA. And I'm almost a constituent of our first speaker, my friend Congresswoman Elissa Slotkin, who represents my hometown of East Lansing, Michigan. Later in the call, we will be joined by national security experts Ned Price and Jeremy Bash. Before we start, we want to offer our continued prayers and best wishes for everyone who's been impacted by the COVID-19 virus, and our hope that everyone's staying healthy and safe during these uncertain times. We realize that this virus is impacting every aspect of our lives, ranging from our work to our healthcare system, education, elections, and the economy, and it is because of these concerns that JDCA has launched this series of calls. These will be held this time every Tuesday and Thursday for the foreseeable future. And today we're going to look at national security. Because this call series is called Democrats Leading in Crisis, we've assembled an amazing group of Democratic leaders and experts to speak with all of you. To start us off, we are thrilled to be joined by Congresswoman Elissa Slotkin, representing Michigan's 8th District. She has spent her career in national service in both Republican and Democratic administrations. After the 9/11 terror attack, Elissa joined the CIA, where she worked alongside the U.S. military during 3 tours in Iraq. Elissa later served in the Pentagon as Acting Assistant Secretary of Defense for International Security Affairs. And since November 2018, she has made the people of Michigan's 8th District extremely proud as their Congresswoman. Earlier this week, she introduced a bill calling on the President to use the Defense Production Act to create the essential protective equipment needed by our healthcare workers on the front lines of this crisis. And this is consistent with how she has legislated since arriving in Congress. Elissa gets things done that matter and has repeatedly demonstrated extraordinary leadership in times of crisis. We're proud to call her a very good friend of JDCA, and I want to thank you, Elissa, for joining us today, and I'm going to turn it over to you.
Thank you, Susie. Thank you to everyone who had this time to come to the call today. I know people are coming in from all over. I hope you can hear me. And please just stop me, Haley, if it's too garbled on the line. Happy to do this a different time. But again, hi, everyone from Elissa from Michigan's 8th District. I'm at my family farm in Holly, Michigan, about to get back to Washington for the vote that we have tomorrow on this big emergency appropriation. And I just thought I'd say a couple of words about leadership in crisis. You know, I was saying just before everyone came on that my job has pretty fundamentally changed in the past 2 weeks, just like everyone else's lives have changed. And I feel like my job as a legislator went from actually proposing tons of bills and having committee hearings and talking to my constituents about what they need to really doing crisis response. I went from working on 10 different issues a day to working on one issue every single day. And because we're just at the beginning of this crisis, what I've just tried to do is unwind some of the most desperate issues that we're hearing about in our district. They won't be very different, I'm sure, than a lot of your areas, but the number one issue right now is we just don't have enough personal protective equipment and tests. I just got off the phone with the mayor of Detroit, and only got more tests in, but he literally has no swabs that he can use to take those tests. And for me, my phone lines in my office were all teleworking. I've reorganized my staff into a task force, and all the phone lines are just constantly being burned up by healthcare professionals, nurses, doctors, just in some cases just crying into the phone, talking about how they don't have masks, they don't have gowns, they don't have what they need to keep themselves safe. People are reusing things and generally feeling like they're going to be victims of, sort of the healthcare crisis that's going on right now. And that's been pretty difficult to unwind. And I know that everyone's talking about it in every corner of the country right now, but I happen to sit on the Homeland Security Committee, which oversees FEMA. So I've spent quite a lot of time on the phone with the FEMA administrator, with the former FEMA administrator, with the new supply czar that was just announced or just introduced by Trump in a press conference a few days ago, our regional folks, everything. And, we will have plenty of time to figure out the lessons learned from this crisis, but it is very clear that we just did not take it seriously early enough. And the real capabilities of the federal government that are unique to the federal government, which is to procure needed supplies in huge quantities in advance and store them throughout the country, just wasn't done in a way that was serious. And so now it is true. States are fighting states. Hospitals are fighting hospitals. And it's, of course, driven up the price significantly. What I will say is one of the advantages I feel like I have being in Michigan is that we still have a really strong manufacturing base. I'm sure you've heard about GM and Ford and a bunch of our suppliers retooling to try and address the problem. To be honest with you, they're doing this out of decency and out of wanting to do the right thing in a crisis. Our auto suppliers in particular feel very connected to the 1940s when they ramped up to support the U.S. military and converted and retooled the factories. But what I did this week was propose legislation that, frankly, I never thought I would propose in my life. As someone who served in the executive branch, I never wanted to be told what to do by the legislative branch on how to manage a crisis, because unless you're really in it and running it yourself, it's hard to understand what you truly need. So I've been, given that experience and working on things like Ebola, I just didn't want the legislative branch telling me what to do. Well, the president has refused to use the authorities that he has at his disposal. And so this week I proposed a piece of legislation basically trying to force the president to use his authorities. And at this point, I think it's probably difficult to hand over the entire FEMA supply chain back to FEMA to try and take it over completely. States are already, including mine, are being bumped in the queue. But what we can do is tell these factories and these manufacturers who are retooling their facilities, give them massive guaranteed orders by the federal government to make sure that they know that their retooling is actually going to make financial sense first and foremost, but also that we have a predictable supply back in our national stockpile. So those are some of the things that we've been doing. And I've really gone to, we've been doing these virtual town halls over the phone where we get 10,000 people on the line. We've been using all different types of techniques to still engage with people. But what people really want right now, especially from their congressperson, is just some sort of understanding that there's a plan. And so that is what I spend the majority of my time doing. It's actually a little frustrating to be in the legislative branch, I must say, but it's trying to force the administration to get a plan, to articulate a plan, and then to reassure people like when things are going to be coming, when they know things are on the way. So I think our governor is doing a great job, but it has been an education, I think, for everybody. And for me, I think we all know we're in the middle of a generational event, just like 9/11 was a generational event, and we'll remember where we were and who we were with when we heard of 9/11 and what happened. We will remember this period in the same way, and we just won't be the same as a country afterwards. We'll have plenty of time to reflect on that, but in the meantime, it's trying to minister to people, and I really think of it as I have a very pastoral job now. I'm easing people's fears a lot personally. I've had other members of Congress who have never served. For instance, I've served in a war zone in 3 tours, and I've handled crises. I have a lot of colleagues who have never done that and who are feeling real stress from not being able to help their constituents. I think it's just a moment of anxiety for people, and the job of Congresswoman has gone from helping people deal with their problems with the federal government and legislating on their behalf to really trying to ease and calm fears and give people hope that we have something in store that's better than today. So I'm going to stop there so I don't talk too much. Thank you for having me, and thanks for your leadership, Haley and everyone on the board, for putting this together.
Thank you. Marcia? Hello? Is Marcia there?
You know, we're having some technical trouble. This is Haley. We're having some technical trouble, so my apologies if you had trouble calling in and if it sounds garbled. We're going to keep going because I do think it's improving, but we'd like everyone to know that unfortunately Maestro, which is the company we're using for this call, is having a national problem. Clearly too many people are conference calling at the same time across the country. Marcia Rickless, our board member, was going to introduce our other two speakers, Ned Price and Jeremy Bash. Marcia? All right. Well, then I will go ahead and
do it? Yeah, go ahead.
Yes, go ahead. Go ahead,
Okay.
Susie. Go ahead.
She may not have been able to call back in, so we apologize for the technical difficulties. Our next two speakers are national security experts, Jeremy Bash and Ned Price. Jeremy has spent the past 20 years advising national leaders and chief executives on a range of strategic management, legal, and policy issues. Jeremy served as chief of staff to both the director of the CIA and the Secretary of Defense in the Obama administration. He was a member of the CIA senior management team overseeing the operation that killed Osama bin Laden, and not many people can say that, and he's currently serving as the founding and managing partner of Beacon Global Strategies. Ned Price also has a distinguished career in national security, where he served as special assistant for President Obama and spokesperson for the National Security Council, after serving as an analyst spokesperson at the CIA. He is currently serving as Director of Policy and Communications at National Security Action. And if Marcia was going to say this, and I will agree with her, if you're like me, you've probably seen both Jeremy and Ned on MSNBC, where they serve as national security commentators. We're extremely grateful to have them both with us today, and we're going to listen to Jeremy first.
Thanks so much, Susie, and thank you, Haley, and my friends at JDCA for convening this. I want to offer 4 comments, all in the spirit of Pikuach Nefesh and the Talmudic injunction that whoever saves one life, it's as if they've saved the entire world. Because I think the challenge facing not just the United States now, but indeed all of humanity is so unprecedented, so unknown, that it requires all of humanity really to come together around a set of common sense solutions to address this crisis immediately. And as Jews, as Democrats, as Americans, and as citizens of the world, we feel this imperative acutely, and I know that's why we've all joined in this conversation today. The first point I would make is that I do believe, having consulted with some of the leading experts in public health and epidemiology, that we are much closer to the beginning of this crisis than the end. In New York over the last 24 hours, the conversation has centered around whether or not you can put 2 and even 3 people on a single ventilator. In the state of California, where there are probably 75,000 hospital beds and only 30,000 available hospital beds, Governor Newsom has said that they need to prepare for about 25 million people with infections. And anyone has only to look at the lines outside Elmhurst Hospital in Queens and some of the other building gathering catastrophes in some major metro areas to see that we are probably 3 weeks away from peak infection in the United States, and that the idea of quarantine and shelter at home is something that's going to be with us for not days, as the president has indicated, but probably weeks and maybe months. Second is that this is a global problem. And while the president and others want to call this the Chinese virus, I think definitively to stoke xenophobia and to stoke fears of the unknown or the foreign or the Asian or the stranger. And as Jews, we acutely feel the injustice of that. It's also wrong as a matter of public health and public policy, because as we all understand in the context of a pandemic, the threat of a virus anywhere is indeed the threat of a virus everywhere. A virus does not understand nationality. A virus does not understand borders. A virus does not understand political party or anything other than biology, other than what all humanity shares in common. And so this truly has to be a problem solved at the level of all of humanity, where all countries are going to come together. And yes, we may have sharp differences with China on other issues. We may have sharp policy disagreements with other governments on other issues. But on the issue of confronting a pandemic, on the issue of pikuach nefesh, I think we all have to work together and not drive wedges between countries and peoples, but in fact find ways for us to cooperate. If we get the curve flattened in the United States, it will do us no good if the fires of the pandemic are raging still in Spain or in Italy or in Asia or in Latin America. This is a global challenge, first and foremost. It's not an America first challenge. It's a humanity first challenge. Third, any approach to a crisis has to be done based on science, has to be done based on evidence, and has to be done based on expertise. And the only way to accomplish the objective of flattening the curve and hunting for the virus and quarantining individuals effectively is to engage in more robust testing of the American people. And the testing is really what has been the distinguishing factor between us and countries like South Korea, where they have been able to test comprehensively and they have been able to find the virus and flatten the curve. And gutting things like the Office of Pandemic Response, which Ned can address, and other tools of our national effort really shows that the effort here has not been based on science. It has not been to marshal expertise. It has been actually in defiance of those time-proven principles of crisis response. And fourth and finally, I would just say that whenever we turn to national leaders for aggressive action in the face of a crisis, such as we're doing now, and we are calling on the president to increase his authorities under the Defense Production Act, there's another side of that I think we have to be careful about, which is we don't want a president or a leader to become too much of an autocrat, too much of an authoritarian leader, perhaps saying things like we need to postpone the election or undermine or unravel some of our basic democratic principles. And if some of you on the call think, oh, they're never going to do that, or that's conspiracy theory, just you wait. Just you wait. I predict that if this crisis is engulfing our country into the late summer, and the president is looking at 4 million unemployment claims, and his poll numbers are sinking, and the economy is looking at a depression, I have no doubt in my mind that he will grab the reins of power in an unconstitutional manner and try to revamp our democracy in ways that are inimical to our basic values. And I want this group on this call to be worried about it. I want you to be thinking about it, because that kind of set of actions not only will not help us solve the public health crisis, but could change America forever. I want to yield now to Ned, and thank you all for your leadership and your attention.
Well, thank you, Jeremy. Thank you to Haley and to the other JDCA leadership and board members. The core point that I want to impart today is simple. It didn't have to be this way. It didn't have to be this way, what we're facing now and what we are potentially facing for months to come. To unpack that a little bit, what we are facing now are multiple overlapping crises. Of course, we all know the threat we face from the coronavirus itself. Our healthcare system is struggling and will soon be overwhelmed. Our supply chains are stretched. And our economy is at a standstill with financial markets roiled. Now, elements of this may have been inevitable. Of course, even the most prepared country isn't immune from a highly contagious virus, a disease like coronavirus. But the scale of the current outbreak and of the current economic crisis decidedly was not inevitable. And to go back to something that Jeremy was alluding to, that stems in large part from a failure on the part of the president to prioritize rapid and early testing. And that derives from the president's refusal to rely on experts to heed warnings over the course of weeks, months, even years. We now know from dogged reporting that not only did the previous administration specifically warn and actually even write a playbook for Trump's team on how to handle a pandemic, but the intelligence community, too, provided tactical warning of the impending epidemic in the weeks before it hit our shores. This was in addition to the strategic warning, the warnings to policymakers over the course of years, especially since 2016, that the United States remained vulnerable to an epidemic. All of this took place within an administration, these warnings, and more specifically within a White House, that in 2018, as Jeremy alluded to, eliminated the pandemics team on the National Security Council staff and fired the Deputy National Security Advisor, who at the time was responsible for Homeland Security issues, to include pandemic preparedness and response. They actually even eliminated that position entirely. That position is now entirely gone. That helps to explain why, rather than take these prudent precautions, like utilizing the Defense Production Act early in order to coordinate the distribution of PPE, as should have been done months ago, Trump opted to do essentially nothing but laud President Xi of China and order travel restrictions that essentially were in place after the airlines had curtailed their service and after hundreds of thousands of people had already left the epicenter of the outbreak. On this testing front for just a moment, let me hone in on something Jeremy was saying, because I think this is really the crux of the matter. President Trump inexplicably failed to use a WHO-approved and German-made diagnostic test. And we have since learned that the initial CDC test did not work. And there was a needless, weeks-long delay in easing restrictions on both who could be tested and allowing the private sector to get engaged in the testing business themselves. And that really explains why the administration has been forced to reach for a sledgehammer rather than a scalpel. And the sledgehammer in this case are the blunt measures we're now forced to take, the stay-at-home orders for over 190 million Americans, I think it is, virtually shuttering the U.S. economy. It's a stark departure from the sort of targeted isolation of infected and vulnerable Americans that widespread testing and contact tracing could have enabled. And of course, we don't have to go into the consequences. I think we all know them well, but unemployment is now at an astounding 3.3 million claims. We learned today the stock market has experienced record volatility. Congress has had no option but to approve this $2 trillion stimulus package, representing some 10% of America's entire GDP. That's the largest rescue package in American history, and twice the relative size of the 2009 stimulus that was passed during the financial crisis. And let me just conclude by putting this in perspective, because I think it's important to compare this to the path that other countries have been able to take, other countries that were prepared and that were able to reach for early and widespread testing and contact tracing, the type of which should have been done here. Jeremy mentioned South Korea. Well, South Korea had its first case on the same day as the United States, and now expects to have passed its peak infection rate, and daily case counts have fallen precipitously, precisely because of this emphasis on rapid testing. Shortly after the outbreak began, 4 Korean companies developed tests with the help from the WHO, and South Korea pioneered this drive-through testing system that we've seen, testing almost 300,000 people versus just about 60,000 in the United States at the same time. And of course, with our relative size, that's a huge discrepancy. Taiwan immediately organized to tackle the coronavirus, beginning testing on December 31st, developing a rapid test that can diagnose cases in 20 minutes, and activating its central coordination mechanism. Despite its proximity to China and its vulnerability in that regard, Taiwan's early and aggressive testing and screening limited its outbreak to just over 200 cases as of this week. A couple more. Singapore took steps to limit the spread of the coronavirus after its first case of community spread in February, including, again, sophisticated testing and contact tracing, and has just over 600 cases in just 2 coronavirus deaths. And then finally, Hong Kong, again, despite its proximity to China, has faced just over 400 cases because of aggressive testing, including an ability to ramp up that testing capacity and to launch outpatient testing programs to preemptively test patients. So finally, as a direct result of these timely and aggressive measures, these countries so far have been able to limit their damage to their economies. Not one of these countries has issued widespread orders to shut down businesses or for their citizens to shelter in place. The situation, of course, is continuing to evolve, but none of these countries has yet reported comparable spikes in unemployment comparable to what we have in this country. And despite their deep dependence on China's faltering economy, none of these countries has to date been forced to institute an economic recovery program greater than 3% of its GDP. And in fact, all but Hong Kong are at roughly at 1%. And just a reminder that the stimulus package represents some 10% of our GDP. So to conclude, there's every reason to expect we would be in a very different situation today, both epidemiologically and economically, had the president, had the team around him taken this pandemic preparedness seriously, had they sprung into action at the first sign of trouble, and if they had been able to take a more targeted approach to fighting their virus, one enabled and guided by widespread testing and contact tracing. At its core, what we needed and what we still need is a response guided by science and by facts, not wishful thinking or any other interests on the part of the president or those in his administration. And with that, I'll turn it back over to Haley.
Great. Thank you so much. I just want to say to everyone who's on the line that we'll now do questions, and you're welcome to send questions in. We'll try to get to as many as we can. Please email them to info@jewishdems.org. We're monitoring them. Our first question is from Ada in Los Angeles. Congresswoman Slotkin mentioned the national stockpile issue and her legislation, which relates to the Defense Production Act. Jeremy, you were Chief of Staff to the Secretary of Defense. Could you please speak about the Pentagon's role, the Defense Production Act, and the President's reluctance to invoke it?
Yes, I can. Thanks, Haley. And Ada, it's a great question. And you're asking here about a piece of legislation that goes back really to the middle of the last century, called the Defense Production Act. And the Defense Production Act authorizes the president, in the interest of national defense, to, in effect, direct the production of certain articles, certain materials, certain equipment necessary for national security. And for many weeks, several experts, Ned's been part of this effort, others have been part of this effort, many experts have been calling on the president to invoke his authority under the Defense Production Act to order the production of ventilators, of test kits, of mobile hospitals, of protective equipment for first-line, front-line healthcare workers. And about 10 days ago, the president claimed that he was going to be doing this. He actually signed a document saying only that he had the authority to do this, but in effect he didn't pull the trigger. 2 days ago, there was a little bit of a false start when the FEMA director, Gaynor, indicated that, yes, in fact, they were going to be invoking the act to create test kits. That also appeared not to be the case. Why? Why have they been so reluctant to invoke this? Part of this, I think, is some Republican orthodoxy around not wanting to seemingly nationalize industry, seemingly not wanting to direct changes to the free market enterprise system. But of course, in a crisis, in a life and death crisis, the president has no greater responsibility than to protect lives of Americans. And if this authority exists, and it does, many of us believe the president should be invoking it and should be directing companies to produce things like ventilators. I mentioned that in New York they're talking about now whether or not they can hook 2 and 3 people up to a single ventilator, something that's never been tried before. The question also referenced a stockpile. I believe that when all is said and done, we will have to create a national pandemic preparedness stockpile that will include probably 1 million ventilators, probably 7 million hospital beds, probably protective equipment for 50 million Americans and 2 million healthcare workers. These are things we don't have that we desperately need.
Great. Our next question is from Lynn in Florida. This is for you, Ned. Who is advising the president? Is anyone advising him on the enormity of the situation, not just telling him what he wants to hear?
Well, thanks, Lynn, for that question. It's really the perennial one with this administration. It's always a question as to who exactly has access to the president, and then who is able to really catch his ear. Because the challenge we found, not just in this context, but really since the early days of the Trump administration, is that President Trump has eviscerated the traditional policy process, especially the national security policy process, that has guided key decisions on the part of previous presidents. It used to be that there was an organized set of meetings of escalating hierarchy from sort of a working level group up to the deputies of each department and cabinet agency, up to something called the Principals Committee that constituted cabinet members themselves, and then culminating in what was known as an NSC meeting or National Security Council meeting that was chaired by the president, where the president, especially in the case of thorny issues or where there were debates, would then adjudicate and decide. Since the early days of this presidency, however, his successive national security advisors, he's now on his fourth, of course, have deprioritized and certainly de-emphasized the decision-making structures around the president for a time, and it sounds like we are getting back to a time like this. The Oval Office was a freewheeling place where aides who perhaps in some cases had no business being there were able to catch the president's ear, to leave articles on his desk. And I think it's always a safe bet that there is some degree of that chaos still in this White House. Now, if you listen to the president, he will tell you that he is listening to people like Dr. Fauci, to people like Deborah Birx, Dr. Birx, who is the White House coronavirus response coordinator, and that may be the case. But this is the president who has never allowed the science, never allowed the facts to stand in the way of what he considers to be more parochial interests. And in this case, I think our collective fear is that the epidemiology and the science and the facts of the anticipated course of this disease will collide with the president's very deeply held desire to open our economy back up as soon as possible, not only to get the country humming again, but to get unemployment back down, to get the stock market back up, just as we enter the summer months and he looks towards November with the presidential election. So I think we will see here another case of the president's personal and narrow parochial interests coming into conflict with what seems to be the universal consensus, at least at this point, among our public health officials, that a premature reopening of the country, that a premature restarting of our full economy could be disastrous in terms of the implications for our public health system, in terms of the toll of this disease, not only, as Jeremy was saying, in the United States, but also it could, again, sweep around the world. And so I think we will see these competing factions develop. And I think my concern is that the president will prioritize what he thinks to be the country's economic interests over our public health interests, probably not recognizing that ultimately what is in our longer-term economic health is probably also consistent with our nearer-term public health interests.
Great. Our next question comes from Christopher Woody. The Trump administration has added new sanctions on both Iran and Venezuela as the coronavirus spreads, and both countries struggle to respond to it. Do you agree with calls to relax sanctions amid this health crisis? And if so, how can that be done without compromising legitimate national security interests?
This is Jeremy. Quick response on that. This question has actually been asked of Secretary Pompeo, and what the State Department has said, and I think it bears some investigation, and interested to know if Ned has a perspective on this, is that humanitarian aid is not sanctioned, and that humanitarian aid can go to those countries. While we try, again, to not use this crisis to somehow relax our overall national security objectives. But I just have to come back to something I referenced in my opening comments, which is this is a problem for all of humanity. And though we may have important, very important disagreements with these countries, with Iran, with Venezuela, with others, on a whole variety of other issues, in my mind, saving lives has to come first. And from a humanitarian perspective, I would want our policy to lean very heavily in favor of ensuring that medical supplies, medicines, protective equipment, things that can't be used, for example, to build a nuclear weapon in Iran, or things that can't be used to oppress in opposition in Venezuela, those things must be able to go to those countries, those peoples, those affected communities.
This is Ned. I would agree with that, and I would just quickly add 2 points. Number one, the administration is leaning on this argument that humanitarian aid is exempted from these sanctions, but sanctions more broadly have a chilling effect on how the international community is willing to deal with countries like North Korea, with countries like Iran, with the regime that is currently in power in Venezuela. And so despite the humanitarian carve-outs and exemptions, you will find a great deal of hesitation and trepidation on the part of the international community to actually provide that for fear that they might inadvertently run afoul of U.S. sanctions. And I think that's a huge challenge and part of the reason these countries are not going to get the aid they need. Second of all, this administration has not taken a uniform approach to the countries currently under these biting U.S. sanctions. And I think nothing better exemplifies that than the letter we recently learned President Trump wrote to Kim Jong-un. And just as President Trump was telling Governor Cuomo and Governor Inslee that essentially they would have to fend for themselves, they would have to get their own ventilators, they should have thought of these things. This was a two-way street. The governors would have to help him out if they wanted him to help them. He apparently wrote, and he's admitted to it now, he wrote a letter to Kim Jong-un offering assistance. The discrepancy between what President Trump has publicly told our governors and local leaders and what he has told Kim Jong-un, and then, of course, the discrepancy between what he is telling Kim Jong-un and the approach he is trying to take to North Korea to a very different approach that he's taking to Iran and Venezuela. Humanity is humanity, as Jeremy was saying. And these are people in these countries, and a resurgence and a grip of this virus in any one of these countries could hold not only implications for those populations, but also lead to another resurgence of coronavirus if not handled effectively.
Our next question comes from Meshulam in Maryland. What might we learn from Israel's response to the virus?
This is Jeremy. I was speaking this morning with family outside of Tel Aviv. Israel has put down very significant restrictions on movement. You're not allowed to go more than 100 meters away from your home. You're not allowed to gather in any gathering outside your home. There are still significant restrictions requiring businesses to be closed. And Israel is also actively working on various therapeutics and various vaccines. In some respects, Israel is a country that we can look up to with respect to how it handles questions of pikuach nefesh, of life and death, of advances in medical science, and of communities coming together for a national purpose. It's also, I think, interesting to note that there are some interesting dynamics in the Israeli political scene, even as we speak, with news coming out of Jerusalem over the last several hours that Benny Gantz may agree to serve as Speaker in a national unity government, Speaker of the Knesset, serving alongside Bibi Netanyahu. And so it seems like Israel is pulling together, even though they've got political challenges, and they're pulling together, and they want to ensure that they address this crisis in as effective manner as possible.
Thanks. Our next question is from Libby. This is a question for you, Jeremy. There have been some calls lately for networks to stop airing President Trump's daily briefings since he seems to be using them as campaign rallies. Why do the networks keep broadcasting the briefings, and can you speak to the decision of some of the networks, I believe CNN, MSNBC, and even NPR, to either cut away or stop airing them?
Yeah, and I'd like actually Ned to jump in here as well. My quick take on this is that there's a careful balance here. On the one hand, there is information provided in the briefings from some of the other briefers outside of the president that I think is important for the American people to know. Second is, I think it is important for the American people to be able to see what their national leaders are saying during times of crisis, even and allow, by the way, people to disagree with those comments and to confront them. I do agree with the sentiment, though, that some of these news executives have made, which is that if it devolves into just an effort by the president to weave lies and mistruths, half-truths, pat himself on the back, or actually put out dangerous information, then there is a public service requirement, an obligation. I can't believe anyone that we've arrived at this moment, but it seems like we have. There's a public obligation to cut away and to provide programming and substance and content that is evidence-based, that is fact-based, and that does not endanger the American public. Ned, what's your take on this?
Yeah, I would very much agree with what Jeremy's take. The news that we learned last night that some of these networks, and we saw this in practice yesterday and perhaps the day before for the first time, are beginning to cut away from the president. I think that is fair, and I think that is right. Acknowledging the fact that, in a way, everything the president says is newsworthy. But when it is a matter of propagating wrong or even dangerous information, I think the networks are taking their responsibility not to do so seriously. I was reading an interview with an epidemiologist today, and he made the point that when President Trump went out there and said earlier this month that anyone who wants a test can get a test, it led to a surge of people going to emergency rooms, some of these makeshift testing centers that were just being set up. And some of these people were healthy. They just had a sniffle, or they had a headache, or they had something that could have been illustrative of coronavirus, but ended up not being so. And the fact that the president told them that anyone who wanted a test could get a test sent all of these otherwise healthy people to stand in lines, to be in waiting rooms, emergency rooms around infected people. The rate of infection because of that one statement may be untold. I think actually that the formulation that the networks have developed over the course of decades now, taking the presidential remarks at the top and then cutting away when other members of the administration start speaking, is actually backwards. We need to, I think there is some utility in still getting a flavor for what the president is thinking. It will help us understand this moment of crisis and the nature of our leadership during that crisis. But I agree with the idea to pull away when he starts to say mistruths or engage in political talk. But then I think there's also an obligation to go back to hear people like Dr. Birx, like Dr. Fauci, the recognized public health experts who are providing Americans with the information that President Trump either cannot or will not. And I think there's great utility in continuing to cover those pretty closely.
Thanks. Our next question is from Steve in Chicago. This is for both of you. Yesterday, foreign ministers of the G7 failed to agree on a joint statement, in part because the Trump administration insisted that the statement refer to COVID-19 as the Wuhan virus. What is your take on this development? What does it mean in terms of U.S. leadership in the world and our credibility going forward? And what damage could this have caused in terms of potentially having a joint G7 response to coronavirus?
Ned, why don't you start, please?
Sure. Well, look, having worked the Ebola response from the National Security Council in 2014 and 2015, I came away from that experience recognizing that the single most indispensable element of a successful approach to fighting and containing any outbreak with international reach, and especially one that has the potential to become a pandemic, is American leadership. In the case of Ebola, the U.S. government, we marshaled an international response that was unprecedented in scope and scale. We pushed every developed and even some developing countries to contribute to the response, whether it was funding, whether it was healthcare workers, scientific know-how, even service members, as the United States and the French and the British did in West Africa. We shared with the rest of the world how we were instituting screening measures in airports, how we were engaged in active monitoring of those who had recently arrived in the United States, sharing best practices in a way that allowed the rest of the world to align their practices with ours and to staunch the spread of Ebola beyond the epicenter, except for a few very limited cases beyond West Africa. We haven't seen that in the case of coronavirus. And in fact, what is so striking about this G7 meeting is a couple things. One is the fact that it's happened at all. The United Nations has been largely silent. The UN Security Council has also been stymied because of a lack of American leadership. The G20 hasn't been engaged. The G7 has met a couple times, but the results have been lackluster. And so I think what we are seeing here again during this presidency is that American leadership is indispensable. When American leadership is absent, no one is ready or able to step up to the plate. In a case like a pandemic, that has really tremendous implications, not only for the rest of the world, but for the United States. I think Jeremy's point is a good one. A virus knows no borders, it knows no bounds. It doesn't matter whether it originated in Wuhan or in Kansas, as the so-called Spanish flu did in 1918. So it really doesn't matter what you call it, but this is also emblematic of President Trump's desire to, for lack of a better term, foreignize every threat he faces. And we're seeing him and Secretary Pompeo do this with, unfortunately, good effect. It's really taking on in some circles. And it's nothing more than a xenophobic effort to blame another country and another people, in this case, China, for the arrival of this disease on our shores that has taken root in large part because of the lack of preparation that this team itself failed to engage in. And so I think it is an effort to deflect blame, and it's effort that is really hindering. It is not only undermining American leadership, but it's also hindering global cooperation.
Great. Our final question, we've had two similar questions, one from Sarah in DC and the other from Jen in Baltimore. As you look around the world at the way other countries are handling this, and in some cases the way they have flattened the curve, what gives you reason for hope? Is there light at the end of this tunnel? And we're all looking for some to end on a positive note here. What makes you hopeful as you look to the future?
Well, this is Jeremy and Sarah and Jen and Haley and Ned. I think we're all like-minded in that we understand that this is a global problem. This is a problem that affects every human being on the planet. And to that degree, we hopefully will not allow any political or national differences to divide our zeal to tackle this problem. And I think when you have a problem that affects all of humanity, all of God's children, really, it is one that that must be solved together. it is one that will require and demand the most ingenious, innovative, groundbreaking medical and scientific approaches. It's one that will also require us all to work together. If any group of us decides, for example, not to engage in social distancing or to not take the necessary precautions, it endangers all of us. And so we're all in this together, and I think as this crisis goes on, we'll realize that only working together can we resolve it. And maybe in that way, the ultimate lesson out of this will be that there are many other crises, other challenges that we face, that our common humanity faces, and that if we can work together to repair the world, to tackle these challenges, and to save lives, that truly is the only path to true security.
I was just briefly going to agree with everything Jeremy said, but I think he put it so eloquently, and especially that emphasis on repair the world on Tikkun Olam is an appropriate endpoint. I would just underscore that what we need now, more than ever especially, is a reliance on science and a reliance on facts. And ultimately that reliance on those two things, I think, within the course of months, knock wood, will help us arrive at therapeutics and vaccines that will help us put an end to this, at least this surge of coronavirus. Hopefully we can get things under control sooner. Hopefully we can begin that process of repair the world. But ultimately I think we'll have to be guided by science, and hopefully before long we will have a scientific remedy, at least to this current phase of the outbreak.
Thank you, Ned and Jeremy. This is Ron Klein, Chairman of JDCA, and we want to thank Congresswoman Slotkin, Jeremy Bash, and Ned Price, the latter two, for their expertise in national security and how this whole situation affects our country both internally and externally. I think the way you sized it up, both of you, science, facts, leadership, all ties it up into one package in terms of how we're going to emerge from this thing. And Democrats will contribute their piece of it. This obviously will develop into an election in the fall to measure whether the country is looking for something different or whether they're satisfied with the present. I think many of us on this call are very concerned about the present status of where we are right now. But we obviously have a lot to do as a country to move forward and emerge from this. I also want to apologize, not that we could do anything about it, but the beginning of this call was a little bit problematic in terms of some of the sound. That was the organization, the Maestro group that provides this. Apparently it was a national problem. It did work out, but it did require us all to listen a little more carefully to this call. It did progress and got a little better along the way. Also want to mention we're running these calls at JDCA Tuesdays and Thursdays every week. The next one we have will be with on Tuesday with Congressman Rose from Staten Island and Sarah Raskin-Bloom, and they're going to be discussing the impact of the coronavirus on the economy. Congressman Rose will be able to give us his views on the economic stimulus number 3, 2, and 1, and how he sees it impacting not only his community in the New York area, which of course is hard hit, but in terms of working with other members of Congress and how they're planning and trying to deal with this on a national level. And we look forward to you participating on that one as well. We have another one Thursday of next week. It'll be on the impact on education, which of course many of us have children at home, and we're dealing with all this impact and how is it going to affect our school, our education system, the requirements. We have a national leader that will help provide us a perspective on that. And the last thing I'll mention is we are Jewish Democrat Council of America. You can reach us at www.jewishdem's.org. You can find out more information about our upcoming calls, the ones we're describing, also our programs, our mission platform, and our fundraising efforts, and how we're going to deploy resources to support candidates around the United States at the Democrat level of Senate, House, and the presidential race, and how we're going to use our contacts and grassroots efforts and communication tools to get our votes out and support the candidates that support our Jewish community, both on domestic things and our strategic support of the State of Israel. So we thank you. We want to wish all of you the best. Stay healthy, stay safe, do everything you can to protect yourselves and your family, and of course your businesses. And we look forward to seeing and talking to you soon. Thanks so much, and have a good day.